I'm Bruce Stevenson, and this is my 40th year as a dentist. And in that time, I've worked with a lot of hygienists and lately had the privilege of working with a lot of other dental practices. And so what I'm going to try and get across in this video are things that I have found and things that I have seen that allow you to improve your patient care and also increase production in the hygiene area. So patient care always has to come first. And I think as you listen to some of the things I suggest, you'll see these are all related to patient care, first and foremost. But going along with that, so happens it increases the production out of hygiene. So see what you think about some of these suggestions. Let me tell you what I'm not going to talk about. I'm not going to talk about lasers or the periscope or ozone or selling products or even assisted hygiene. And not because these things may not be good for patient care and may not be profitable for the practice, but simply because I don't see them used very often in other offices, and particularly in the case of the first three, they require a considerable purchase of equipment. And that's not what I want to talk about. I want to talk about things that are essentially free, that provide better patient care without spending very much money, that may require you to make some changes in your office and the way you run your office, but don't need very much in the way of change from the doctor, because doctors are tough to change. The first thing is we want to keep the patients in the practice. And this is not just a hygiene issue, this is a general practice issue. We work so hard to get patients in the front door, often spending quite a bit of money to do that, and then turn around and just welcome them right out the back door. Don't do that. Most offices do not pay enough attention to patient retention, and they may end up actually losing more patients in a given year than they gain. You need to look at the numbers. So over there on the right hand side, you see the number of new patients and the number of patients lost from the practice. That's defined as the number of people who have not been in the last 18 months for each month. And down at the bottom, we have a total for the year. So this practice sees a fair number of new patients. But look at that. Over the course of the year, they've lost 50 patients. They're down 50 patients. The practice is growing. It's growing smaller. So how do you prevent that? In Open Dental, we have a really good recare module. And I think this is something some person in the office needs to manage, and manage fairly closely. It doesn't take a lot of time. You're talking about probably 5 minutes a week. And rather than farm this out to Demand Force or Lighthouse or Solution Reach, not that those aren't good systems, but I think that this is better managed in-house using the tools that Open Dental has, which I think are far better than any other software out there. So in this practice, we're looking at the patients who've been due for a recall over the course of the last 12 months, but do not have any future appointments. And we got 433 people going out the back door. So how do you keep from losing patients out of the practice? You pay more attention to recare. The other thing is you do two things. This is kind of our mantra. Two things before a patient leaves the office. First of all, they pay their patient portion, and secondly, they schedule their next appointment. Scheduling their next appointment helps the patient because it helps them get the care that they need. And we're not just talking about recare appointments here, but it also obviously helps the practice. It's very difficult to do those two things, collect money or schedule an appointment after the patient has left the office. So do them while the patient is in the office. This is kind of our mantra, to do these two things before the patient leaves the office. If you will do these two things, which are easier said than done, but if you'll do these two things, it will make a big difference in your practice. So take that to heart. Talk about failed appointments. That hygienist's not making any money this hour, okay, because her patient didn't show up. Well, what can you do about that? Here's two practices over on the right-hand side. The practice on the top, I love graphs. Okay, you're going to see that. The practice up on the top averages about 3% of their patients failing appointments. About 3% of the appointments they make are failed. The practice on the bottom is 30%, a tenfold difference, with a high of 40%. They really spiked up there. So the point is not to criticize this office. The point is to say, you know what, if some other office can get those failed appointments down to 3%, you ought to be able to do it too. Okay, how do you do that? One thing is everybody in the office needs to be on the same page about how important recare appointments are. And I have told every patient, every new patient, and everybody in the office repeats this to patients. The single most important thing we do for people is clean their teeth. I believe that. That's what keeps their teeth in their head. That's what gets cavities while they're small. That's when we pick up problems sooner. So get them back for the recall. I firmly believe that. And I would tell patients that. And that's one reason why the recall part of the practice will grow. Okay? Everybody in the office needs to have that phrase roll off their tongue. And when somebody says it's only a cleaning, you say, oh no, don't you remember what the doctor told you? Cleaning teeth is the single most important thing we do for our patients. So we also have a little checklist, and I'll put this on the website, for trying to save failed appointments. There's never one thing. It's not one magic bullet that you can do to stop all your failed appointments to get down to 3%. It's a variety of things, and you got to do them all. But this is kind of the centerpiece. All right, what else can we do in hygiene? Most practices, or I should say at least many practices, do not do enough perio maintenance. And how much is enough? As a general rule, this procedure of 4910 should be about 1/3 of the number of prophies that you do. So if you do 100 prophies a month, you should be doing about 33 perio maintenances a month. Say, well, you know, I've got a younger practice, they don't really need all that perio maintenance. Okay, the other rule of thumb that you can use is to multiply the number of root planings that you do by either 2 or 3, someplace in that ballpark. So if you looked at this practice, they should be doing over 50 perio maintenances a month, and they're doing 15 by using 1/3. If on the other hand you want to multiply by the number of root planings, they should be either doing 40 or 60. So you're getting about the same number either way. The point is, this is a prophy palace, and you don't want to be a prophy palace. This is not good patient care. You're doing root planing on people and then turning around and they're going right back to being prophies. Right, so if you're doing root planings, at least initially, those patients should be on perio maintenance. You need to be sure that you tell the patients why they need to have perio maintenance and why they need to have root planing. And don't reinvent the wheel here. There's good brochures out there from the ADA. I think every patient that has root planing should get these two pamphlets, the scaling and root planing and the periodontal disease. And you should personalize these a little bit by opening, got some nice little diagrams inside, and saying, this is where you are. This is what you have, Mrs. Jones. And write on that, you know, put a circle around it or something with your pen. So you personalize it for the patient, and then you give it to the patient. And when the patient finishes their root planing, however many sessions that's going to be, they get this pamphlet, the perio maintenance pamphlet. What's the difference between perio maintenance and a prophy? And if everybody in your office doesn't know the difference, they all should read that pamphlet. But it seems to me it's up to the hygienist to explain to the rest of the office the difference between a perio maintenance and a prophy. Okay? Why should a patient suddenly, they've been in practice for a long while, they've been coming in every 6 months, and all of a sudden you're finding some 5 and maybe 6 millimeter pockets, and they need to have root planings. How do you handle that with a patient? Well, here you go. I just copied this right off their website. That's what that big S is for right there. I just did a screen capture. This is from the American Association of Periodontists, and about all the factors that contribute to periodontal disease, and certainly age is one of them. So you can sit down, you've got this information, you can hand it to the patient, you can circle, say, hey, you're smoking, you're getting old, we don't like to hear that. The medications, all the different contributing factors. This is why now we're recommending root planing. So people have solved this problem. Let's don't reinvent the wheel, but we need to let patients understand the reasons why they need to have this treatment, okay, and the reasons why they need to come back. Another thing that you can do in open dental is to be sure your recall, when you're in the family module up here on the upper right, if you double click on that, you get this window that opens. And you want to make sure when you do root planing that you click on the set perio, because that changes them from an adult prophy to a perio. And it changes the recall interval from 6 months to 4 months. Now you can override that and say 3 months or whatever you want to do. That's the global default, is 6 months and 4 months. So it does that automatically to help remind you, along with all the rest of the things that are in there and the recall reminders, that this patient is now a perio maintenance patient and not just a prophy patient. How about some other, we're talking about perio procedures here. What are some of the other procedures that you should think about doing? Arrestin hasn't gone away, but it doesn't seem to be quite as popular as it was a few years ago. And I think Arrestin works. I think used judiciously, not jamming it in every 4mm pocket, but using it judiciously, and I don't mean to just narrow this down to Arrestin. There's other products as well, PerioChip and so forth, but Arrestin is kind of the best known. The insurance generally will not pay for this as part of root planing. However, they may pay for it with proper documentation at a perio maintenance appointment, like 4 months later. So again, document it properly, and perhaps you can get the insurance to pay for it. Whether they pay for it or not, this, I think, is an effective modality in selective cases. So be aware of that, think about that, don't just forget about it and don't use it anymore. Another thing that some offices use is this Perio Protect, which is the little custom carrier trays, and you have to have them made by specific laboratories and so forth. I don't know what the literature says about this. I'm not an expert on that, but I have heard anecdotally from several offices that this really does help patients. Okay, probably not going to be covered by insurance, but of course that does not mean you shouldn't do it. If you think it's beneficial to the patients, then by all means you should do it. And the third thing on there is irrigating as part of root planing. When you do this with chlorhexidine or whatever solution you're using, in conjunction with root planing, generally the insurance company will deny it. They're saying this is part of the root planing procedure. You may not, depending upon your contract with that carrier, you may not be able to charge the patient an additional fee. If you don't have a contract with a carrier, if you're out of network and you choose to do this, it's a beneficial thing to do. But just keep in mind that most insurance companies and most contracts think that this is part of root planing. Anyway, there's 3 other procedures there that you might consider. This is becoming more widely used. This is the caries risk assessment based on the Canberra caries prevention stuff. And this is from the American Dental Association. So this form is from the official form from the American Dental Association. And they have one that's for people under 6 years old and one for people over 6 years old. And it's a checkoff form. And you can set this up as a sheet in Open Dental. And so the hygienist, this doesn't have to be done by the doctor, the hygienist can just very quickly check these things off and then give the patient, you print it out and give the patient a copy to take home. Nobody's done this before. Now, that's why I think it's important with a perio pamphlet, when you're discussing the perio problems, that you circle things, that you personalize it. This is personalized just for that particular patient. Nobody's ever given the patient something like that before. So that's good for the patient and good for the practice. And here's more good news. Insurance companies are now beginning to pay for this. Their procedure codes have been there for a couple of years, but now here's Delta's PPO. They're going to give you a whopping big $5 for doing that. Well, $5 is $5, and that's the PPO fee too. So a lot of insurance companies will still not cover this, but more and more we're seeing that this is covered. So there's your procedure codes. I suggest that you attach a note to that procedure code. So when you post that procedure code for this patient, it automatically puts that note in there. And we're talking about fluoride varnish in just a second here. When we post the fluoride varnish, we have this note in there. And you notice part of that is the patient has been advised that it may not be covered by their insurance. Okay, now don't put it in there if you haven't told the patient that. But this is just to save you some time, and I think you should put that in there. When you bill the insurance, you want to capture these two things, bill them together on the claim, and then if you need documentation, just capture those from your notes with something like NEA Fast attached and send it to the insurance company. So I think those are a good use of attaching notes directly to a procedure, default notes, so you never have to type that stuff in there again, but also the sorts of things that you need to be talking to patients about. And you need to create a new procedure that the patient declined the fluoride varnish. And there's your note that you talked to them about that, and the patient said, no, they didn't want to do the fluoride varnish. Okay, they certainly have the right to refuse it, but you should document it. Okay, and that's how you do it. Let's talk about fluoride varnish a little bit more. Very many offices are using the wrong code. They're using the code for fluoride trace, which is a 1208. And they should be using the code for fluoride varnish, which is 1206. So make sure you're using the right code for that. This is often now, increasingly, let me put it that way, covered for both children and adults. So this is not just for kids anymore, okay? But use the correct code. Typically, we find either the 1206 for fluoride varnish is covered at the same rate as the 1208, in other words, the same fee, or it's covered at a higher fee. I've never seen it covered at a lower fee. But it also is much easier and faster and has much better patient acceptance, and it's more effective in fluoride and trace. So everybody should be doing fluoride varnish for both kids and adults. One of the uses for it is cervical sensitivity, and it works okay. But if it's not going to be reimbursed if you bill it for sensitivity, which is a 9910. So let's kind of keep that in mind. You may get it reimbursed, though, when you've documented it with your caries risk assessment. So, summary on fluoride varnish: you want to do a caries risk assessment. Whether you charge for it or you don't, I think you want to do it. You want to give the patient a copy because that's just good patient care. You want to discuss the fluoride varnish with the patient. Now, there are some people, I will admit, there are some people that do not need to have fluoride varnish. If you've got a healthy 25-year-old that's never had a restoration done and has great plaque control, then probably that's not going to hurt, but it's probably not going to be of a great benefit. But if you looked at the risk assessment form in there, anybody with any kind of prosthetics, any crowns, any recession, new caries in the last 3 years, any medications that dry their mouth, all these things predispose patients to caries and pushes them into a higher risk category. So those people should be getting fluoride varnish, and the benefits should be explained to them. I think you have a professional responsibility to explain it to them. Okay, so we discussed it. We're then going to bill the insurance with the documentation, but, and this is where a lot of practices, I think, make a mistake, if the insurance doesn't pay, they don't bill the patient, they write it off. No, I think that's a mistake. This is a benefit to the patient. You've explained it to them ahead of time. They understand the insurance may not pay, and you've documented in the chart, so bill the patients. And I think you keep a relatively low fee for this to improve your case acceptance. Now, commonly I see fees $40, $50 for fluoride varnish. I think you're better off $19 to $25 in that range. Your overhead's about $1. So I don't want to talk a lot about fees, but I will mention it for that one. Lower fee for this, but increase the utilization. Let's go back and talk about sensitive teeth. Pretty common complaint that patients have. So are you addressing that? Are you doing anything for the patients? And are you charging appropriately? Now, I mentioned that a 9910 usually will not be covered by insurance, but that doesn't mean it's not beneficial. And it doesn't mean, just like with the fluoride, that you inform the patients that the insurance may not cover it. Do they want to do it? Yes, they do. Okay, if you use the fluoride varnish for sensitivity, I'd still bill it probably as a 1206. You can use one of the self-etching primers and put a little coating on there, and that works for a while. You also might use some silver diamine fluoride, and we'll talk about that in just a second. But this has been approved by the by the FDA for sensitivity. We're going to use it for caries here in a few minutes, but it's been accepted for sensitivity. So that's something you got to be a little bit careful with this, because it does tend to stain gingiva, and it will stain caries, but it will not stain sound tooth structure. It'll also stain you. If you get any on your clothes or on your hands, you've got to be careful with it. But it will come off your hands and off the gingiva, but won't come out of your clothes. So you got to be careful with that. So again, are you addressing the patient's concern about the sensitivity? And if you're doing something, you probably should do something. Are you charging for it? Charging appropriately. Let's talk about sealants. Offices either do sealants or they don't. It's not really very common to see an office like this that does 8 sealants in 1 month and then 0 the rest of the time. Most of the time, what I see is practices that either have embraced sealants and try to do them, or they said, the hell with it. The trouble with sealants, resin sealants, is it's kind of like working in a swamp, and you need pretty good patient cooperation. And typically, by the time the patient is old enough to cooperate, the sealants aren't going to be covered by the insurance anymore. So they kind of got you on that one. So what I'm suggesting is you might want to visit glass ionomer sealants. You know, we're used to resin sealants, composite resin sealants, where you have to etch the tooth and keep it dry and so forth. Glass ionomers are much easier to apply. The retention in some studies is not as good. In other words, they may fall off, but they release a lot of fluoride while they're on there. So go check this out. I'll try to put a link on the website for this. They're easy to apply, particularly for a single operator. Difficult to do resin sealants with one operator. But glass ionomer sealants are easier for one operator. And there's some evidence that shows that they actually are better at preventing caries than resin sealants are. So think about that. It may increase the number of sealants that you do for your younger patients. For your older patients, you might think about custom fluoride trays. You can use these on younger patients too, but compliance is going to drop to about 0 probably. But we all have patients in the practice, typically older patients, that are on multiple medications, that have terrible xerostomia, and they're just getting caries faster than we can fix them. Fluoride trays may be an effective option for these people. Gordon Christensen says you got 10% of the patients in your practice that would benefit, and I say, yeah, but only about 1% will use them. But for somebody who does use them, you know, these have been around for 1,000,000 years. You can make them out of something that's kind of like bleaching trays, only it's a little bit thicker material, so it holds up a little bit better. And then put whatever your favorite fluoride in there. And this might be one instance where you dispense and sell that, or you just send them to the pharmacy for it. But this is an option that we should think about when you see particularly the older patients that are just have caries everywhere and a dry mouth, and there's not very much we can do for them. Fluoride trays should be perhaps considered a little bit more often. Here's the other thing. This is a silver diamine fluoride again. There is a procedure code for it. It costs you about $100 for that little tiny bottle, but it's got lots of applications in there. And it's being pushed primarily for pedo patients. So this little kid's got rampant caries all around, and the option is you can take him to the hospital and put him to sleep and restore all that, and then do that same thing again next year because the caries tend to come back. even when they're properly restored. Or you have the option of using silver diamine fluoride and arresting the caries. Now, this doesn't repair them, but it arrests the caries. It also, unfortunately, turns the teeth black. So this may be a consideration for some people, but, rather than put the little kitty to sleep in the hospital and all the risks associated with that and the expense, this may be a very viable option. And so the pedodontists are using this for that. Where I think it has a big benefit is just like the older patient we were just talking about with the fluoride trays. What are you going to do in a situation like this? There isn't anything, even glass ionomer, that I can put in there that's going to last very long. So this is kind of a ray of sunshine for these people. Again, it's not going to make this tooth any stronger, but it will arrest the caries. So you dab some of that on there, it just goes on a little cotton pellet. Try to keep it on for a minute and keep it dry. It will stain the gingiva. That's not a big problem, though, as a matter of fact, and it will stain the caries, but it won't stain the healthy tooth structure. What else are you going to do for a patient like that, or for a situation like this? Yeah, there's a lot of plaque there, but it's almost impossible to restore somebody's mouth when they look like that and have anything that's going to last for very long. So again, thinking about silver diamine fluoride as an option both for little kids that are uncooperative, but also for the senior citizens. Just again, put that in your little armamentarium there. Think about that, and maybe do a little bit more research on that for your office. So this, you got to buy $100 for that little bottle, but it's a very useful adjunct. And this can be done by a hygienist. How about cancer screening? Yeah, it certainly should be done by the dentist, but you don't have to be a dentist to do this. I think this ought to be done by the hygienist at every single hygiene visit. And let the patient know what you're doing. And you know what? When you grab their tongue, don't have to hurt them, gently grab their tongue and look on the sides. They remember that you did it. And in a positive way. My hygienist checks for mouth cancer every time I go in. That's very reassuring to people. Again, it enhances your profession as a hygienist, but also promotes really good patient care. Should you charge for that? No, I don't think so. I think you just throw that in for the patient benefits and also for your personal benefit. This is a good thing to do for people. And you know what? People say, well, I'm afraid to do that. I don't want to tell somebody they don't have cancer. You are liable whether you do this or not. If that patient, you as a hygienist, if that patient suddenly gets a mouth cancer the size of your fist on the side of their tongue, and you've been looking at it for the last 5 years and haven't said anything, you're liable for that. That's your responsibility. Yeah, the dentist too. But, again, you might as well look for it and try to pick this stuff up early. And if you find a suspicious lesion, obviously you're going to call the dentist to take a look at it. So you also want to promote the practice a little bit. Now, this isn't going to directly bring you any money, sort of like the oral cancer exam, but this is a really good idea. You're sitting there with your instruments in the patient's mouth when they can't talk back very much. And so at least take an opportunity, and you should have a little spiel that you change probably about every month, to tell the patients about something good about the office. Last month the whole office did this or did that. We went down and prepared meals for Meals on Wheels, or we went to the CDA care and provided treatment for indigent people, or whatever. We all went out to dinner and got drunk. I don't know, whatever you want to say. But again, to something positive about the office that you can sneak in there as you're scaling away promotes the practice, and that helps you too, because as the practice succeeds, the hygienist will succeed, and vice versa. The other thing that you should do is, have you ever thought about replacing this ugly composite on this front tooth? Maybe don't say it quite like that. Have you ever thought about straightening these teeth? You know, you don't have to have metal braces anymore. It can be done with Invisalign in a few months. Are you interested in that? Would you like to talk to the doctor about that? That's what I want them to say, because that's all I do is Invisalign now. But whatever it is, and you should have these little scripts that while you're scaling away there, that you have a perfect opportunity. You're not marketing, you're not throwing something down the patient's throat that they don't want. You're just presenting information. And I think that's a very important thing to do. Don't miss that opportunity. What if you could be more efficient in delivering care? What if you could cut 10 minutes off your standard appointment time and see more patients a day? Okay, don't panic about this, because you have to be more efficient in order to do this. And I'm not saying be in a big hurry. I'm not saying be sloppy. I'm not saying do substandard care. Not at all. I'm saying be more efficient, like the guy wants to put round wheels in place of the square wheels on the cart. Going to make everybody's life easier. Okay, let's talk about being a little bit more efficient. You remember, you've probably seen the video of Lucy and Ethel working in the candy factory there. And first of all, the conveyor was going by really slow, so they had no trouble keeping up. And then by the end of the video, the conveyor was going really fast, and they're shoving the candy in their mouth and everywhere else because they're getting behind. Okay, there's probably a sweet spot. If you haven't seen that, by the way, you can look at it on YouTube. There's a sweet spot between those two extremes. So maybe you can speed the assembly line up just a little bit by being a little bit more efficient without going crazy like they did down there on the lower right. So think about that, and let's talk about some ways to increase efficiency. One is with your charting. You write the same thing over and over again, you know, with some slight changes in there. Okay, with Open Dental, you can use the auto notes. So auto notes, when they're properly set up, will simply prompt you for a series of responses. So here it says, how about plaque? You want to chart the amount of plaque, and so all you have to do is check these things off. You can check them off with a mouse, or you can check them off with a stylus with a tablet computer, which is a pretty nice, convenient way to do it. So this not only is much faster to do, but it's more accurate because you don't leave anything out. It prompts you for all this information. And the last thing right here is this area of concern. And we talked about before giving the patient a reason why they need to come back or they need to have the treatment done. So you want to have, for every patient, a reason for them to come back. I want to keep an eye on this bleeding you've had up here around number 3. Or it looks like you might have an old filling that's kind of breaking down here on your lower left. And we'll be sure and check that when you come back next time. So every patient should have and understand that there's an area that you want to check, and I think you can find at least one area on every single patient that you want to check when they come back. And all I'm saying is just write it down, especially if it's real quick and easy to do with something like the auto notes. What else? How about the what we call auto recare appointments? And that is, let Open Dental, when you have this set up properly, automatically populate the appointment with the things that will be due when that patient's due to come in next. So in this case, Donald Duck is going to be due for perio maintenance, and Open Dental knows that's going to be in 4 months, and so it will jump out automatically to 4 months in the future. If he was a prophy, it would jump out to 6 months. Okay, it also knows that Donald's going to be due for 4 bite wings next time. So anything that's set up as a recare, Open Dental will keep track of, and all you have to do is click a couple buttons and then find the time that you want. You don't have to see this. These 4 months is going to go figure on your fingers how far out that is and what procedures are going to be in there. Much, much quicker, much faster, much more efficient. How about voice charting for perio? Okay, the software is free, and I've got a link on the website about this. The headset will cost you about $50. So you can call off the pocket markings. You can call off bleeding, recession, suppuration, anything that you want to put in there, you can enter with your voice, and it echoes back into your earphone, so you know what you said, you know that it understood you. Hey, you don't have to hunt around for another person in the office. or come back later from a tape recorder and re-enter all that stuff. Much more efficient to do it this way. How about reserving some time in the schedule so that you can get new patients in and so you can get root planing patients in? If your recall schedule looks like this and you've got a new patient that needs root planing, where are you going to put them? You're all booked up, and you may all be booked up for 4 months. And if you really have a practice that believes in the value of recare, eventually you're going to have a recare practice that looks like this, okay, with 4 hygienists and 1 provider, 1 dentist. So what I'm saying is block some time ahead of time. And how many of these blocked appointments you want to save is going to depend on how much you need to use them, how often you need to use them. But you're going to block out some appointments, some hygiene appointments, and not fill those until either 3 to 5 days, depending upon the practice, 3 to 5 days before the appointment. So 3 to 5 days out, you open up these block times if you haven't already filled them. And now, because you had good verbal skills, you can move, or whoever's in charge of moving patients can use the ASAP list and fill that schedule. So I'm not saying you just leave those holes blank. Whenever 3 to 5 days ahead of time, you go ahead and fill those blocked, those pre-reserved appointments with patients. But you're keeping appointments available for new patients and for root planing. That makes your time more productive. The other thing to consider when your hygiene schedule looks like this is to have the doctor just do annual exams instead of exams at every appointment. And when you've got 4 hygienists and 1 provider, the doctor's going to have a tough time. He's going to be on roller skates. And you're going to be busy waiting for the doctor, which is a time waster. And the doctor is going to be busy running over here to see recare patients and not be productive in his own column. So think about having the doctor do annual exams rather than every 6 months. And the hygienists have to be tuned in to watching for things, to talking to the patient, but with good verbal skills, say, hey, you know what, if I don't see anything today and you're not having any problems, I don't think the doctor needs to do a re-exam. He'll just see you next time. Is that okay? And most patients are delighted about that. And some aren't, and so that's okay too. And you need to signal the doctor, and we have a little light system that we'll talk about in a different video that's built into Open Dental, so you can let the doctor know when he or she needs to come over to do a re-exam. So the hygienists need to play a bigger role if the doctor's only going to see them every other time. But that's okay. You're not doing exams, you're just kind of monitoring things. So this will make your life less hectic and make everybody more productive. How about a bonus? Everybody wants a bonus. Okay, well, there's different kinds of bonuses for the office, and we're going to talk specifically here about the hygiene bonus. But I think bonuses are not a present. I think bonuses are for performance that has improved. And the way typically we measure that in an office is by the production. So, everybody wants change, but nobody wants to change. Okay, well, the bonuses are going to be based on hygienists, for the most part, and the office having to change. Okay, let's put some round wheels on the cart that has square wheels. Let's make things more efficient. Let's do some of those other procedures. And then what are you going to do? So you go from $600 a day to $1,300 a day, and that's very doable, by the way. So now the hygienist is producing twice as much money per day and doing better patient care. How does she share in the money? Not to be too crass, but everybody needs money. And we have a little formula that we suggest, and that is that the hygienist gets 30% of anything above a certain threshold amount. So he or she gets a daily, hourly amount, but then they will get 30% above their production. What's the production level? Okay, you've got to decide for your office and your situation. So if you're at $600 a day average for the hygienist, and you jump up to $800, Okay, so how much of that does the hygienist get? Or you jump up to 1,000, or you jump up to 1,300. And typically what happens is the hygiene production is going up and up and up. And I'm not saying they always get 30% of that. I think you have to renegotiate this initially, probably every 4 months. But I think having a reasonable goal, it doesn't go up forever, by the way, because you're going to be limited to how much you can ethically produce. But I think that at least initially you've got to reevaluate this probably about every 4 months. But there, and you can figure out a formula that's fair to everybody. So I definitely think that bonuses are not only fair, but they also provide some incentive. But they're not just a present. You got to do something. So kind of think about that for your office too. All right, here's all the things I talked about here. We talked about 17 different things to make the practice go from this, kind of a $600 a day hygiene practice, to this. Okay, all the things we talked about have increased, and a lot of other things have increased too. But these are sort of the basic things that we talked about in there. So it's doable, and you can do it. And all these things not only increase production, almost all of them increase production, but they definitely, every single one of them, improves patient care. So hopefully that was helpful. And that is the last slide at last. I'm sorry it went a little long, but I hope I covered a lot of material that you can actually use.